Good morning, everyone, and thank you for attending our 17th annual Compassion Fatigue Conference. My name is Diane Henderson, and I am a medical consultant with Gluckstein Lawyers. For almost a quarter of a century, hard to believe, I have worked directly with our lawyers, tertiary and community hospitals, and healthcare providers. I'm sure that over the years, I've worked with many of you that are attending today. Many of you have become lifelong friends.
My name is Bernie Gluckstein, the founding partner of Gluckstein Lawyers. I'm proud and honored to say that since 1962, our firm has been considered by our peers to be one of Canada's most prominent personal injury firms. However, giving back to the community is one of the most important values we hold as a firm. Holding conferences such as this is one of our ways thanking those of you who assist our clients and others to achieve maximum recovery from their injuries. The last 3 years has been a challenge for most of us, both professionally and emotionally. Hopefully the tools you're about to learn will somewhat assist both you and your clients come through this pandemic.
That is our hope for sure, Bern. Compassion has always been at the heart of what we do at Gluckstein Lawyers. This annual signature event is about giving back to our community and those who work to care for others, whether it's family members, nurses, social workers, doctors, teachers, or even lawyers. We all know that the challenges of caregiving and the challenges of professional life can be draining. And we are also coming to understand that these challenges are taking a toll on our physical and emotional well-being. This event will hopefully give us all some insight into how we can address compassion fatigue and get back on track, feeling like ourselves again.
Today, we're excited to welcome back Dr. Godum. Now, you may remember her from last year's conference in Ottawa, which was fantastic for those of you who attended. We also want to welcome our panelists from the Werklund School of Education. Now, Dr. Godum practiced as a psychiatrist for over 20 years. And she now devotes her full time coaching other physicians on how to build up resilience and excel as leaders. She is considered by her colleagues as the doctor's doctor.
The panelists include Dr. Gereluk, Dr. Kendrick, Dr. Volume-Smith, Dr. Everett, and Dr. Capoyanis. They will be talking about a recent study that involved compassion fatigue within the education sector. They will dive into what strategies are needed at both the organizational and individual levels to prevent or address compassion fatigue or burnout. Finally, they will introduce to you streaking as an option for maintaining your sense of well-being when life seems overwhelming. We know that virtual conferences can sometimes make you feel disconnected from your community. That is why we made this event live. We hope that in the future we can make the Compassion Fatigue Conference a hybrid one, so we can offer many the convenience of a virtual event and others the intimacy of an in-person event. What would a conference be without prizes? This morning, we are giving away $400 gift certificates. Watch out for a link in the chat, enter the draw, and stick around until the end to see if you have won. The cards will be emailed directly to you after the conference. Lastly, please take a few minutes to complete our survey. Your feedback is invaluable in helping us improve and make sure we are meeting your needs. A link for the survey will appear near the end of the morning session, and it will only take a few minutes to complete.
I want to thank everybody for attending and welcome to Compassion Fatigue 2022. I want to welcome back Dr. Gereluk.
Thank you so much. It's a real pleasure for me to be here this morning and be invited back to this amazing conference, which I really enjoyed last year. Compassion fatigue is a workplace hazard for caregivers across the service sector industries, regardless of what your specific profession is. If you are interacting and taking care of other people, then you're at risk of compassion fatigue. I am a psychiatrist in Ottawa. I've had over 30 years focusing on the wellness of healthcare professionals. And I want to share with you a little bit of what I've been hearing over this time. Certainly this pandemic now into its third year has had a major impact on health and well-being, not just of healthcare providers, but of all of us in society as we live and work and adapt to this. The past 2 years have been what we call a VUCA world, full of volatility, uncertainty, complexity, and ambiguity. And we've all been living with this uncertainty just hanging overhead as we, initially, very early on in March of 2020, started to anticipate the impact of this new virus and the pandemic coming towards us. Then we looked at how are we going to be ready with PPE and be able to respond, and then there was a bit of relief in the summer of 2020 where we hoped perhaps there would be some recovery. As we all know now, we went into a second and a third and a fourth, and now just finishing hopefully a sixth wave of this. And you can see what we have gone through is closures and reopenings and closures and reopenings, and for how long, right? And so that's kind of that uncertainty that we've all learned to live with. In December of 2020, we started to hear about vaccines. And I remember certainly in medicine, we're looking at them and thinking about them as liquid hope, right? This was going to change everything for us. And we were suddenly going to be able to master our ability to cope with this virus. And of course, you remember, starting January of 2021 across the country, we had difficulties initially with supply of the vaccine, with how it was rolled out, who was going to have access to it, and how we were going to deliver it. And now, of course, immunity, as I've just received my fourth vaccine shot, right? Thinking, okay, how many more of this is going to happen? And then there are variants, right? We initially dealt with the Delta variant, then there was Omicron, and now there are different subvariants of the Omicron. And again, we have no idea of what's ahead. What we see in the healthcare world is that there has been a surge in patients throughout all this, shortages in staff as a result of all this, and we're all really just pushed to the brink, like we're all exhausted. And to set the stage for the conversation today, I just thought I would share with you, make sure that we're all on the same page in terms of some of the words that you're going to be hearing. Perhaps they will be defined by the panel as well. But, what we're talking about is stress. Stress in its in one form is very positive, very enriching. We have all actually used stress to help us push harder through a difficult situation. So in of itself, stress is actually not bad. It's how we manage that stress that makes it good or not good. And remember that there's a spectrum between stress on one side and distress on the other. And effectively, distress is when you can't keep functioning like you used to, right? So we start to see some of those signs. We've heard of the word burnout. We've been hearing about it a lot throughout this pandemic. Coming into the pandemic, we had healthcare workers, having perhaps incidents of work of burnout, perhaps like up to like 1 in 2, right? So it was already an issue before the pandemic, and some more recent studies in Canada are showing that that has at least doubled throughout this pandemic, so that we're looking at, from going from like 30 to 40% to perhaps 60 to 70%, which is really, almost crisis proportions at this point as we try and support our staff in healthcare and in other professions across the service sector. What is burnout? Burnout is basically a work-related syndrome where the demands exceed individual resources. Again, more likely to occur in jobs that require caring for others, which is what everybody here does, right? So you can see we're more vulnerable to this. There are 3 stages of burnout that colleagues described to me over the years. The first is emotional exhaustion. And at this stage, we're able to do everything that's asked of us, and people around us on a day-to-day basis would have no idea that we're starting to struggle. But what happens is we get to the end of the day and we're exhausted, right? We're drained. We don't have anything left for anyone else. And people will say things to me like, Mamta, at the end of my day, I just, I don't want to talk to anybody. I'll come home and I'll put up a journal or an article, just very tangible reminder to my family, don't talk to me right now. People will say to me, I'll come home, I'll drive into my driveway and I'll just turn off the car and I'll just sit in it for a few minutes, right? Just trying to gather up some energy to go in and do the next part of my day. That's the first stage of burnout, that emotional exhaustion. Then we move into depersonalization, where we start to realize it's the people in our lives that are the most draining. So we start to pull away. We start to disconnect from people in our workplace. We don't really make eye contact. We just go down the halls looking at the floor. We'll grab a sandwich at our desk instead of going to a common space. And so these are the kinds of things we see in the workplace, but we do this in our personal lives as well. Whereas before, you'd want to get to the end of the week so you could see family and friends. Now, going out to see family and friends or having them over is like just one more thing you have to do, right? And we start to find ways to kind of get out of doing any of that. And then we move into that latter stage of burnout, which is a reduced sense of personal accomplishment. And this is now when it starts to impact us in the work that we do, where we start to question, are we achieving what we had hoped to? Is it as satisfying as what we had hoped it would be? And this is the stage where many of us consider, is there something else that we could be doing, right? And so that's burnout. Throughout the pandemic, we've also seen compassion fatigue. Compassion fatigue is sort of this emotional and physical exhaustion where you aren't able to show empathy or have compassion for people as you would normally. And it's really like the negative cost of caring. It's not exactly burnout, which is really related to some of the system level issues. It's more of an internal inability to refuel and regenerate. And it's not actually the compassion that we give to our patients or our students or our community that is so draining. But what it is this empathetic distress, right? Like what we're doing is we're mirroring the distress of everybody around us, and it's just so draining. We're absorbing all that trauma, which makes it hard for us to refuel and come back. So many of us have experienced not just burnout, but also compassion fatigue. I also want to add a couple of other terms that you may or may not have heard, and certainly I'm sure have all experienced throughout this time. Moral distress. Moral distress is kind of the challenge of sort of simultaneously knowing what it is you would like to offer your patient or your student or your family member, but not being able to because of systemic limitations, right? In healthcare, many of us have dealt with that moral distress. We know what we want to do, but we can't. We've had to make ethical decisions about who gets admitted, who gets into the hospitals, who gets to visit which patient, who gets admitted to the ICU, who gets that last ventilator, right? These are really hard decisions to make that eat away at us, that cause us that moral distress. And if we do enough of those, we have moral injury and that sense of personal injury that is really, again, added to that sense of burnout and compassion fatigue. And again, all of this has worsened throughout the pandemic, which has actually put us into more of these kinds of ethical situations than we've ever had before. And kind of superimposed on all of that is the sense of grief, right? Through this pandemic, we've all had so many losses, just loss of the way things used to be, the loss of normalcy. And we will, perhaps find another sort of next normal, but we're not entirely there yet because of the volatility and the uncertainty and the ambiguity that continues to exist. And so that makes it really hard. The way we used to do things is not now automatically the way we can continue to do them or restart them in what's ahead. that makes it really hard. Every time we lose something, we have to grieve it, right? So the sense of normalcy, the sense of certainty, the sense of control, the sense of safety, the sense of, being able to predict some things in the future. And as we grieve, we go through those stages of grieving. Right. Initially, we were in denial. It was really hard through this pandemic to stay in denial. And so we had to shift away from that. We go into the next stages. The first after denial is anger and protest. So, we're not happy about this. This isn't fair. It shouldn't be like this. And many of us tried to push against it, resist, maybe bargain, hope that if we did this, it would come back to normal. And it hasn't. And certainly, I think many of us are starting, to process the fact that this loss is the way it is, and it isn't going to go back to what we had before. So we go through that anger and protest, we go into sadness as we recognize that loss, and acceptance at some point, and then integration. Since this is the way it is, how do we integrate this into our lives? And again, as caregivers, and in whatever aspect of the work that we do, which involves taking care of others, this has been a part of it. So you can imagine, right, the impact you've personally experienced it, but remember that you are living and working with other people, all of whom are also experiencing the same thing, are processing it, perhaps at multiple levels, and at different times, and maybe at a different stage than where you are at this point, right? So important for us to understand, and more importantly, normalize it, right? If you're feeling any of that, it's not because you're weak. It's not because you don't know how to focus or handle things or cope. It's because you're human, right? And this is really what we're talking about, the humanity that we all bring, the compassion that we all bring to the work that we do, and how can we do it, in a more supportive environment, supporting each other as well as supporting ourselves. Knowing that that's what we're dealing with, we are so excited to introduce to you this amazing panel that we have today from the Werklund School of Education, including the faculty dean, Dr. Dianne Gereluk, the Alberta Teachers Association, and the Alberta School Employee Benefits Plan in our discussion of streaking out of compassion fatigue. The panelists are going to talk about their recent 2-year study that you heard about into the experience of compassion fatigue within the education sector. They will detail strategies needed at both the organizational as well as the individual levels to prevent and address compassion fatigue and burnout, as well as introduce that idea that Diane referred to, streaking for well-being. As you will see, while this is research that comes from the education sector, all of this is transferable from that sector to all professionals in any service level sector, including those of us in healthcare. It's now my sincere pleasure to introduce the members of the panel. Dr. Dianne Gereluk is Dean and Professor at the Werklund School of Education at the University of Calgary. Her research examines normative aspects of educational policy and practice, specifically related to politically contested and controversial issues in education. More recently, Dianne has written about notions of well-being in higher education. Dr. Astrid Kendrick is Director of Field Experience in the Community-Based Pathway at the Werklund School of Education, and she is the principal researcher of the Compassion Fatigue, Burnout, and Emotional Labor Research Study. Before taking on her current role, Dr. Kendrick was a kindergarten to 12 classroom teacher for 19 years, specializing in physical education and English and language arts. Her current research focuses on compassionate fatigue, burnout, and emotional labor in Alberta educational workers. Dr. Dora Kapayanis is the Director of Field Experience in the On-Campus Pathway in the Werklund School of Education. Here she oversees the placement of 1,100 pre-service teachers and collaborates with over 50 field experience instructors. Before taking on her role, Dora was a kindergarten to 12 teacher for 17 years and served in several specialist and consulting roles. The panel also consists of Dr. Lisa Everett, who is with the Alberta Teachers Association, where she has worked as an executive staff officer since 2006. She's developed expertise in a wide variety of areas, including labor relations, employee benefits plans, educational research, and women in leadership. And prior to joining this association, Lisa taught high school mathematics in Northwest Territories and Alberta. And Dr. Carlin Volume-Smith is the Chief Stakeholders Relations Officer at the Alberta School Employee Benefit Plan, which is a not-for-profit organization that proudly provides health and disability benefits to more than 60,000 employees at Alberta's Public Health Education Centre, as well as their families. Dr. Volume-Smith also participates in collaborative research initiatives within the education and health benefits sectors, providing subject matter and methodological expertise and insights. So excited to bring this panel together to hear about their research and to hear about some very tangible, concrete strategies that come from that research that can translate into supporting you and your colleagues every single day as you continue to do the compassionate work that you do. Thank you so much. Over to you, Astrid.
Thank you so much. That was a wonderful opening and a great way to start. So I'm just going to throw in the chat. We have an interactive component to our webinar this morning, and it's really helpful to know what's going on out there. So if you want to grab either a phone or open a second tab on your browser, don't close this one or you'll lose the webinar if you are opening a second tab. But if you can either grab your phone and you take a picture of that QR code there, or you can go to mentimeter.com and enter in that number. What'll happen is you can interact directly with myself and the other panelists throughout our presentation and then through question and answer. So it's a little bit more interactive than throwing stuff in the chat, just because sometimes it's hard to manage all the things going on at once. And you don't have to worry, it's completely anonymous. So whatever you write won't be associated with you. It'll just kind of, you'll come up in a bar graph or dots or some different words and stuff. So I'll just give you a second to get logged in there, and then once you're in Menti, you can start answering that first question. And again, this is really helpful because otherwise, when I'm talking, I feel like I'm just talking to a video camera in the middle of nowhere. So having this little bit of interaction kind of helps to keep me on pace in terms of what it is that what you're thinking out there. So I'll just give people about 30 seconds, maybe even not that long, to get logged in, and then we'll get going here. And so as you can see, we are coming from all parts of Canada. Myself and the other panelists, we're located in Alberta, which is home to Treaty 6 and Treaty 7, as well as Métis Nation 3 and 2, consisting of members of the Cree, Blackfoot, Tsuut'ina, Stoney, and Nakota peoples of Canada. And we are happy to work and play here on these lands in Alberta. So also recognizing that many of you are coming from Ontario. So if you wish, you can take a second to acknowledge the Indigenous peoples in your area. So interesting to see that you, so far the most are coming from Toronto, a couple from Brockville, London. So far I don't see too many other people from Alberta, so I guess that's good. So my next question for you is, what was your job? So this one you'll have to answer both in the same thing. What's your current job and what lifted your spirits at work this week? So whoever is the lawyer who likes chips, you know what, that actually lifted my spirits too, but I'm not sure if you mean the same as potato chips for me on those days when I need to really crunch. Some employment, working with other people, nice weather, that's good. Today, it's a bit windy here in Calgary today, but I think it's supposed to be nice by the weekend. Of course, May long weekend, you know, is often snowing. I don't know about how it is out east. Settling a stressful matter, that's pretty good. Checking in with a friend, people needing help, working with others. And so a lot of this is really around being a part of caregiving, right? Being able to provide care to your clients and to other people. So this session is streaking out of compassion fatigue. What we're going to do is I'm just going to talk briefly about the research study that was recently completed, as well as some of our main findings and some future directions. And then we're going to go into some of the strategies that we're trying out in order to build more support for individuals within the education sector. So I'm just going to pass it over to Lisa and Carlin, who are going to give a little bit of information about why this study was funded in the first place. So Lisa or Carlin, would one of you like to jump in?
Thank you, Austri. I'll start, and perhaps Carlin can fill in the blanks that I miss. This particular research study is one that for me personally has evolved over a number of years. I worked at the Alberta Teachers Association and in teaching, and of course, there is a lot of caring that you do because the work that we do at the association and in classrooms is highly relational. So we care for the students that we work with, we care for the communities that we serve and the parents that are also working in common goal to raise children to be their best selves and to go forward into the future in a good way. As a staff officer with the association, I did notice from 2006 to about 2014, there was a shifting conversation around mental health and how that was connected to the workplace. And so in my role as a staff officer with the ATA, I was speaking often with teachers and school leaders who would be suffering the effects of burnout or compassion fatigue. And we would have a discussion about what that meant with respect to sick leave or applying for extended disability. And at the beginning of my career with the ATA, there was a discussion around how we framed mental health for the purposes of sick leave and extended disability. And that discussion quite often revolved around the teacher or the school leader who was calling being sick and that the illness was rooted into themselves. And while work may be a factor that contributed to that illness, the environment at work was not solely responsible for the illness itself. And so for me, this really this didn't sit well. And so as we saw the Canadian psychological safety standards being rolled out for what it means to be safe at work, there was a shift in the way I began to think about the role of a workplace and illness. And so that brought me a couple years later into a different role with the association, one of research. And I had the very good fortune of connecting with Dr. Carlin Volume-Smith at the Alberta School Employee Benefit Plan in December of 2019. And at that very first meeting, which was still in person at that point, Carlin and I were able to have coffee and talk about what was happening in the education sector with respect to mental health. Because of course, Alberta School Employee Benefit Plan was seeing people who were coming and applying for extended disability or people who were on disability. So we were having this common concern as organizations, and we wanted to do some exploration of the phenomena of compassion fatigue and educator burnout so that we could better understand programming that might be helpful for the profession of teaching and helpful for other education workers. And so we had our meeting. We both institutions agreed to provide some funding for the study. And we were fortunate enough when we were looking out on the academic landscape to be able to connect with Dr. Kendrick. And from there, she became our principal research, and we engaged in a 2-year study, which accidentally caught the pandemic situation. So this study is one that was not conceived to be surrounding what has happened over the course of the pandemic, but it was structured and planned prior to the pandemic. But by accident, we did end up catching the effects of the pandemic. And so now I will turn it over to Carlin to fill in what I might have missed and add some insights from the Alberta School Employee Benefit Plan perspective.
Yeah, thank you, Lisa. Yeah, just to echo Lisa's comments in terms of some of the trends, there are two main reasons why the School Employee Benefit Plan or ASEBP wanted to evaluate this a little bit more. I think firstly is just seeing the trends that we were seeing in our extended disability line of benefits, seeing increases in that sort of claiming activity, as well as an increasing proportion of those claims being related to mental health issues as opposed to physical issues. So certainly we were seeing increased demands or increased concerns regarding mental health within the education sector. We were also seeing our employers or the school jurisdictions asking for additional support for psychological benefit, whether that be expanding the type of providers we would allow to be claimed within our benefit plan, or increasing the dollar limits on psychological benefit within the benefit plan. So we were seeing those pressures on our covered members and their families, and that was something that was concerning to us for the reasons that Lisa cited. Perhaps a second reason that wasn't mentioned, and maybe a more selfish one from ASEBP's standpoint, is that we have a number of staff that deal exclusively with our covered members and their families. There's a decent proportion of them that work within the extended disability side of things. And as you can appreciate, they're individuals who are talking to our covered members on a regular basis, often helping them navigate through obtaining disability coverage in situations where an individual may or may not get back to work, and having to hear about the stresses of their lives, and having levers to be able to help the covered member address them, but in some cases feeling powerless to address some of the overarching concerns. So I think looking at compassion fatigue and understanding that our staff themselves might be suffering from compassion fatigue was also another piece of the puzzle that we wanted to look at, because we felt that internally, if we had some strategies to help deal with that with our staff, we would ourselves have a healthier staff complement who would be better able to support our covered members and their families. So that was another reason that ASEBP was very interested in this study.
Thank you, Carlin and Lisa, for that background. And so it was in about early January 2020 when I became involved. So my next question for you is, how is your bucket? So in the education sector, and as noted, I was an English language arts teacher for many, many years. There's a story that's often told to our students, and it's about filling your bucket with good things. So the story goes that, you have your bucket, and every day you want to put good things into it to keep your bucket full. And when your bucket is full, then you feel happy and joyful and everything is okay. But what I want to know is not so much what's going into your bucket, but how's your bucket? So sometimes you can be putting all kinds of really good stuff into the bucket, but if there's one or two holes in it, it might all be leaking out. Or maybe you're brand new to your job, and so your bucket is full of good things and it's holding up well. Maybe you're a bit rusty, but you're made of Teflon and there's no problem there. Or maybe you just need a golf day, and so your bucket is actually more holes than bucket. So, I'll give people a couple of seconds to decide the quality of their bucket. And I want you to kind of think about that in the back of your head as I'm going through and describing the study in a little more detail, just so that, because it's kind of a key metaphor there. So, I see so far, most of you are doing pretty good. There's a couple leaks, but your bucket's doing okay. A few, there's a big hole and everything. Doesn't matter how much good is going in the bottom because it's all coming out the bottom. And there's a few people that are, in need of a day of golf, perhaps, or something. So a couple newcomers, but good to see that, the majority think that you're doing okay, but you're recognizing that, maybe there's some work to be done here. And I'm just going to throw the directions back into the chat there. So if you came in late and didn't have a chance to log in, then you can. So a little bit about the study. So it was 2 years. And like I said, I was brought on in January of 2020. And then as Lisa and Carlin described, the whole idea was conceived of years before I came in terms of realizing that there was something going on in the education sector, but not really sure what it was or how extensive it was. So it was a 2-year study, just wrapped up, just finished writing the final report and article. And we will give you a link to that in the chat soon. So started with that extensive literature review, which involved reading as much as I could with help from my research assistants about compassion, stress, compassion, fatigue, burnout, and emotional labor to really understand and how to situate what we were learning in the education field in terms of how it was looking and how it was going. We used exploratory mixed methods, so a mixture of quantitative and qualitative research data. And we had 3 different surveys that first went out June 2020, and then 2 separate ones in January of 2021, just to see how, if there was any change over time and kind of how things were going. So we had over 4,000 complete responses, which is a lot of good data. In between, my research assistants completed 53 interviews with educational assistants, teachers, superintendents, bus drivers, so people from across the education profession, across the field, to see, how it was sitting with different people. And then I had an advisory council consisting of members from the ATA and the ASEBP, as well as from the University of Calgary, to see if what I was finding from the data rang true or made sense with their lived experience in the field. And then wrote 3 separate reports, and I'll let you know where to find those. Hundreds of pages of reading if you're looking for it, as well as a peer-reviewed article that was recently published. So the purpose of this research was to explore the scope of compassion fatigue and burnout across Alberta's education workers, because at this point, as Lisa commented, there wasn't a sense of what was happening, or even if it was a problem at all. And then to uncover what the lived experience was. So understanding what it looked and felt like for educational workers if they were feeling these forms of mental health distress. And then to use what we learned to try and make things better. And so, one of those things that's often comes up when people talk about what happens at the academy or in the faculty is that there's no connection to practice. And so built into creating this research study was this sense of, what are we going to do with this? It's not enough to know that it exists. It's not enough to know how much of it exists. What are we going to do about it? So those were the main purposes of the study. And like I said, we use mixed methods. So this is for people who really want to know the details. You can read through that. But know that in order to figure out the numbers for compassion stress and compassion fatigue, we use the Professional Quality of Life Survey, which is the gold standard for assessing those conditions. We use the Maslach and Jackson Burnout Inventory in order to understand what the symptoms were. And then to understand emotional labor, we used work that I had done during my doctoral work. The qualitative research was, as I said, those 53 interviews with a range of educational workers from all across the sector to really understand how it was felt. And interestingly, we did find that it was across all different job categories. So it was felt by teachers, by educational assistants, by principals, by we spoke to one accountant who was also suffering. So recognizing that it's very much common. And so we had, 7 main findings, and I'll let you read these because I'm going to go into the more detail in a second. The main one to start with is this idea of emotional labor. So what is emotional labor and how that impacts the field? That educational workers rely heavily on building and creating warm and caring relationships professionally with their students and children in their care. We found significant evidence of mental and emotional health distress, understanding that this is related to the conditions and not the pandemic. They weren't using a lot of interventions in order to relieve this stress and distress that they were feeling in the field. And that they were providing crisis and trauma work. They felt stigma around asking for any kind of help, that schools were in fact a workplace and could be either toxic or a positive place for people experiencing this form of distress. And then, of course, the pandemic was also happening. And so that was part of what came up in terms of how people were experiencing the pandemic. And some definitely experienced it as a traumatic event. And so underlying this whole study is the idea of emotional labor. And I like to describe emotional labor in kind of contrast to other ones that we understand. So the one I always use is manual labor, physical labor. So my brothers-in-law, I have two of them, both of them are electricians. So when they decided to become an electrician, they knew that as a part of their work, they were going to have to do manual labor. They were going to have to, carry cord. They're going to have to climb ladders to get to the ceiling, to get to the lighting. My one brother-in-law is currently working and is working at the university, actually. And so the elevators aren't working yet, so he knows he has to go up and down the stairs every day. So they knew when they went into and became an electrician that they were going to have to, in fact, provide manual labor. So when people go into caregiving professions like education, like healthcare, we know that we have to provide emotional labor. And what that is, we have to present a certain, facade, I guess you would say, in order to create a safe and caring environment for the people with whom we work, the people that we care for. And so what you see on your screen is what was highlighted as the main acceptable and unacceptable emotions, or the emotional feeling rules in the educational workplace. And so what that means is that educational workers feel that when they're in a school, in order to create a safe, warm, and caring environment for children and youth, they need to be joyful, they need to be excited, they need to be happy, they need to be calm, and they need to repress very dominantly, as you can see, sadness and anger. And so these emotional feeling rules are what were expressed within our survey data. So how we got these was, the question was, name three emotions that are acceptable at work and not acceptable. So you can see that across those 4,000 responses, there's very clear evidence of that emotional labor that is provided at schools. And so in terms of what it looks like, the first is modeling emotional responses. And I would say that this is probably quite similar across professions. And in fact, the initial understanding of emotional labor came from Arlie Hochschild in the 1980s. And she described it in relation to flight attendants. And so with a flight attendant, we're expecting that they are cheerful, they are happy, they'll provide your drinks with a smile, no problem. And if they're feeling any other way, so if they're frustrated with a client, or if they're angry, or if they're having a bad day, or they didn't sleep well, they're going to put that away and try and be the flight attendant that we all expect. And so in terms of the education profession, teachers may not feel, safe, warm, caring, joyful, but they're going to try and express that with their students. And so if they are actually feeling those feelings, and they're providing something known as deep acting, which is, the pleasure or the joy or the passion that comes from teaching. If they're not feeling that way, so if they're actually feeling grief, which, as we right off the top, this is something that's quite common, they're going to try and repress the sadness and try and find joy. And so in showing how they're not feeling, they're providing something known as superficial acting, which is that pretending, which is quite difficult to do all day. And so within the education field, one of the main things that educators do is they're trying to model, what appropriate responses look like. So, if they're feeling angry, rather than saying, I am angry, they will say, and I'm going to go into my teacher self here, Dr. Kendrick is angry. Dr. Kendrick is going to count to 3, take a deep breath, and no longer be angry. And so modeling that response doesn't allow me to actually express anger, right? I'm actually trying to think through it and teach my students how to express their anger while actually feeling it in the moment. And so that can be quite difficult to do. And then there's caring for students. And children and youth are very attuned to if their educational caregiver is not genuinely caring for them. So recognizing that demonstrating care is a very key part of what makes children and youth feel safe within the school environment. And so they need to feel that from their educational caregivers. And so, like I said, it's that teaching students how to self-regulate by regulating the self and kind of putting the self in the box. So, when I'm Dr. Kendrick, she's very calm and warm and caring and energetic, but Austri back here might be really sad or having a tough day or didn't sleep well. But we're going to kind of keep her out of it and try and just be Dr. Kendrick. And then also developing those relationships, not only with the students in their class, but also with their families. And so, one of the examples was from an assistant principal who was having a very heightened parent in the office. And the parent was just kind of going after the assistant. Why isn't this happening? And my student needs this, and my child like that. And the AP was feeling very angry and was in fact like gripping the table so tightly that her hands were completely clenched by the end, but still trying to keep that safe, calm, patient exterior despite, the clenched hands underneath. And so it's some in those relationships that they provide this emotional labor, which it can be extremely draining. It's also important to recognize that it's neither good nor bad. It's neither positive nor negative. It simply is. It's a part of entering a caregiving profession to be able to provide this emotional labor. And so just as my brothers-in-law knew if they're going to be an electrician, they are going to have to provide physical labor, I knew going into teaching that I was going to be providing this emotional labor. So how that impacts in terms of how that is a part of compassion stress and compassion fatigue is that it's in providing compassion and empathy that it's an incredibly important part of being an effective educator. And so we took all the data from all the surveys and all the interviews and essentially came up with this diagram. So this is evidence-based. It came from the research. And this, I'd like you to think of this not as the continuum as step 1, step 2, step 3, step 4, but as kind of a range and something that people can flow through from compassion satisfaction to compassion fatigue, sometimes within the space of a class change. So, when I was teaching phys ed, for example, I would often teach the same lesson all day, right? So I was teaching kindergarten to grade 2 phys ed. And so we would be practicing throwing skills. So I would set up in the morning and do it with each class, and they're 30-minute classes. So it was like really quick, right? And so, my first class, the students loved the activity. They played it really well. They all cooperated with each other. It was wonderful. And I'm like, I am a good teacher. I am so good at this. And then my next class would come in and they hated it. They hated, they didn't get along with each other. They didn't like the activity. They weren't good at throwing. There's 1 or 2 who didn't like me personally. And I'd be like, I am a bad teacher. Oh, I'm so bad at this. And then my next class would come in. They'd be like, so this is great. This is our favorite. This is all wonderful. And so that kind of compassion satisfaction to compassion stress could kind of go up and down, like from minute to minute, from class to class. So recognizing that you can feel all of these things simultaneously, right? So you can kind of go from feeling that compassion satisfaction, which is being able, it's the joy of caregiving, of doing the work that you feel like you're meant to do, having a positive impact on the future of the people that you're working with, having experience, knowing how to do it. And, in the education sector, from role to role, it's knowing they're having a positive impact on kids that builds that sense of, I can do good. I see suffering in the world. I see the pain, but I can make a difference. And so it's all important. But then things get in the way of that. And so we have crisis work, trauma work, and burnout, which can really drain on that compassion satisfaction. Or if we think about our buckets, these can start pushing holes into them. So crisis work within Alberta, natural disaster. Several years ago, we had big floods. There's been fires. There's actually one of the participants spoke of being a part of the big fires in Fort McMurray and actually having they were teaching and the fire started and they had to actually take the kids and drive through the fire. So that's crisis work. They're right in the middle of it. Or during the floods, in BC recently, we had student teachers who were in the schools that were flooded. So they were in fact, providing meals and that kind of stuff to the kids who were displaced. So that kind of crisis work kind of threatens the stability of our buckets, should we say. And then we have trauma work, which is listening to the trauma of others. And in the education field, that's often the trauma of children. And so kids talking about neglect, abuse, lack of food, death of a pet, all kinds of different things. And that can strain the educational caregiver. And then burnout. And Lisa's going to talk a little bit more about that. And so recognizing that these things kind of threaten the quality of our buckets is really an important part of what we learned in this study. So based on that, this is to bring you back into the conversation. Do you think, and I guess maybe I gave you a little spoiler, but do you think that educational workers on the whole are providing crisis or trauma work? And so I should have asked this question before I told you the answer. So yes, educational workers are providing both crisis and trauma work, and it's actually a very common everyday daily occurrence. So it's not only during those big crises such as fires and floods, but within their classroom, right? So when there's a big thing that happens at the school, there are the teachers and the assistant principals and the custodians who are managing it on the spot. Or trauma, which is different because when an educational worker provides trauma work, they're doing it often in a very public arena. So it's not that they are sitting, alone with a child who discloses abuse. Often that disclosure happens in the middle of a class. So when I would be teaching Romeo and Juliet, for example, some things would come up in the middle of class where a student would say, "Oh yeah, my uncle attempted suicide this weekend." And all the other students would be like, "What? What are you talking? What happened?" And so the trauma work doesn't happen one-on-one, client to therapist kind of situation. It often happens in a public, large arena. And so the teacher is trying to process what they've just heard, the disclosure, and also manage the other 30 children who have also heard the disclosure. And so the nature of the trauma work is quite difficult to bear because of the fact that it's public. And so in terms of, this is just a review, the risk factors for secondary traumatic stress, which is compassion stress, and secondary traumatic disorder, which is compassion fatigue. These are across professions. The ones that really are highlighted in terms of the educational field are under personal, the level of training. So educational workers at present are not highly trained in providing any kind of therapeutic or crisis intervention. Even though they are primarily first responders when these things happen, they have a very low level of training in terms of not only what to do in the situation, but also how to respond and how to care for themselves after they've been through it. The next one in terms of client is age. And so again, within the educational field, we're always working with children and youth between, age 6 and 18. And as you know, I'm sure, the younger the client, the younger the person experiencing the traumatic event, the greater the risk of secondary traumatic stress to the caregiver. And so because educational workers are always working with children and youth, they are always kind of at a greater risk. And then the last one I want to highlight is caseload. And so like I was just saying, the nature of doing the crisis work is very public. And so educational workers in some ways are kind of playing whack-a-mole. There's 30, 35 kids in their class, and something will come up, and it won't just be the one child. So, one child may say, yeah, I didn't get breakfast and I'm starving. Okay, here's some food. And then another child, on the bus this morning, someone said this to me. Okay, I've got to talk to that kid. And then over here, yeah, my dog died on the weekend. Okay, I've got to get over here. And so they're constantly trying to get to all the kids and almost doing sort of a constant triage. Like, okay, well, I'm not going to worry about the pet. I'm going to worry about my hungry kid, but this child over there needs a jacket. We're going out for recess. And so the more kids that there are in the classroom, the more moles there are to whack. And unfortunately, the gaps between who the teacher can help and notice becomes bigger. And so that caseload kind of exacerbates that moral distress that was talked about earlier in terms of, I can't get to them all, I can't hear them all. And then, at the end of the day saying, oh, I didn't get to the kid whose dog died. Oh, and feeling, really horrible about having missed someone who has experienced that trauma. And so the main finding, and so you can see it there on the screen in terms of the scope of mental and emotional distress, is that, and this is based on that ProQual, Professional Quality of Life survey. So these numbers, it wasn't, are you feeling this way? It was, tell us what your number is, and then we can tell you what you have. And so 54.3% of educational workers reported compassion fatigue. And concerningly, of those who reported compassion satisfaction, when we looked more deeply at the numbers, their numbers indicated they were moving closer towards compassion stress than compassion satisfaction. So that's quite high. That's 1 in 2 educational workers who are feeling the symptoms of compassion fatigue. And then the other part of this was looking at how compassion fatigue and burnout were interlocking with each other. And so Lisa is going to hop in and talk a little bit about burnout.
Thank you, Austri. As you noted on the infographic, that was the compassion continuum. One of the factors that could intensify the experience of compassion fatigue was burnout. And so in burnout, and we'll move to the next slide now. In burnout, we know that there is a distinction to be made between this and compassion fatigue, even though it may be experienced in a similar fashion in terms of the impact on a person. But burnout occurs over a long period of time. It is can be a career-long phenomena, but most certainly it happens when your emotional output is not being met with emotional input and allows you to thrive. And so there's an erosion of the self, and your mental well-being gets to a point where you may come to this situation where you're so empty and you feel like you're burning up inside. It's a very serious medical issue, and as was noted at the beginning of our presentation by Dr. Gautam, it is something that is experienced in 3 stages. And so when we considered what we found in our literature review in terms of what burnout is, we found the description of the 3 phases of burnout as the following. The other thing I want to say about burnout is that, and this is really something that has struck with me because I wasn't the one who said it, someone else mentioned it. I was in a different session, and the comment around burnout was that burnout is not the result of a skills deficit. And so for those of you who are experiencing this phenomena potentially, or moving towards this phenomena, it's not because you are not good at what you do. In fact, it is something that puts you at greater risk for burnout. And so what does it look like? Well, in terms of our work, the first manifestation of burnout is emotional exhaustion. And this is the place where you are tired every day. You come home from work, you're not waking up refreshed and ready to go. You're beginning to lose your sense of joy, and you're starting to feel a little bit frustrated within the work that you were doing. And so when we go to the next slide, which we won't yet, but you will see that in the education sector, there are high levels of exhaustion being reported. The next phase in terms of the model that we used was a lack of accomplishment. So you begin to feel discouraged about the work you do. Perhaps you're beginning to put yourself into an emotional box and putting yourself, bounding your output because you cannot do what you used to do and you don't feel good about what you used to do. I was at a conference, a women's conference in the Canadian Teachers Federation earlier this week, and one of the comments from one of the participants was, I really am hoping to be able to feel my joy again. And this is someone who is likely experiencing a situation where they may be in burnout, and most certainly joy is a part of compassion fatigue, but it also can come out in burnout where there's a lack of accomplishment and you don't feel very good about the work you're doing. And then finally, the last stage that we identified was that there is a state within burnout where you can no longer interact with people in a humane way because you simply do not have the ability anymore to be compassionate and empathetic. And so depersonalization happens with students or colleagues, and it can manifest as well, that's just you. We don't need to worry about you. So for example, if you have a student who is not doing well, and I'm thinking high school math because I used to teach my high school math. If you are in the stage of depersonalization, you would simply say about a student or consider your students as being a group that if they weren't doing well in math, and this is not uncommon in math, so I'm going to pick on my own subject area for a minute. Where you don't feel that you have the ability to go in and help them, you will just simply see them next semester. You become more callous and you feel blamed about what is happening in your life by your students and potentially by your colleague. But at the end of the day, you don't care, and this is something that we are paying attention to in the education sector, because while it's not codified for all education workers, as teachers and school leaders, we must be able to, as a part of our professional standards, have effective relationships with our students and with our families. And so if we can't see our students as humans and relate to them in that way, because we are in burnout and a depersonalization stage, it's a very serious consequence, not just to the people that you're working with, but to the teacher or school leader themselves. And so when we think about burnout symptoms in adults, which of these symptoms do you think causes the most harm to children and youth? And I may have given that one away as well. Hey, Astrid, we're teachers. We're just so excited to share what we learn. We have to just fill it out there.
That's right. It's kind of it's like an assessment. How well are you listening?
Yeah, exactly. So my bad. It looks already that you are identifying that depersonalization is something that would cause a lot of harm for children or youth. But I suspect within your own context, this would be something that would cause harm for the people that you all work with. And I know that we have a variety of jobs and careers that you all do, but at the center of many of them is going to be able to function effectively in terms of the relationships that you build with the people that you serve. And so if you're unable to do that because you've put yourself in that box and are unable to relate because your emotions have been overextended to a point that you're experiencing burnout, you are probably going to have a lot of difficulty with the work that you do. So in terms of the teaching profession, what did we find when we developed a scale using the Maslach and Jackson burnout scale? We found a lot to be alarmed about, unfortunately. We found, like with compassion fatigue, there is a wide scope of mental and emotional distress. And in the chart in front of you, you will see the symptoms of burnout, exhaustion, lack of energy, and those are the top two being reported during the course of the pandemic in our other surveys as well. But we certainly have some risks, I think, within the burnout scale of people being in that first stage. When we continue down the list of things that we measured for in terms of the 4,000 participants who filled out our surveys, we begin to see sleep disorders or reduced performance on tasks, and concentration problems. So we begin to get into cognitive areas where people are starting to break down and have difficulty with making decisions. And if you think of a classroom situation or a school situation, life in those buildings moves very quickly, and you have to make thousands of decisions in an hour. Do I talk to this student? Do I not talk to this student? Do I need to reach out to my school leader, my principal, to ask for some assistance with the student? What are all the things that you're having to decide within the day? Do I smile at my colleague? These are all things that require a high level of cognition and a lot of concentration. And so when we begin to see in high proportion concentration problems and memory problems, coupled with an inability to make decisions, we begin to understand that some of the conflict that we're seeing within collegial relations and some of the challenges that teachers are facing with their students may also be a function of the fact that they are actually burning out at this point. And then finally, we begin to see that last stage, that third and most destructive phase, the depersonalization, in the reduced desire to help students and colleagues, and a lack of commitment to the work that is being done. And so our findings, while they are alarming and they are very serious, certainly for the field of education, we are also seeing these kinds of things in other fields. So this is not an uncommon result. I think if you were to take these scales and apply them, for example, to health, while the percentages might be slightly different, we would probably see some real similarities. And from our perspective, this study really begs us to ask the question, so now what? Because we can't just leave it with all this really frightening kind of terrible statistics. We need to think about what comes next.
And so we're going to kind of bring in more of the panel now. Just a reminder, you've heard now from Lisa and Carlin. Also on the call today, we have Dr. Gereluk and Theodora Kapianis. And so the next part of this particular session, we'll look a little bit more deeply into the so what now part. So what are we going to do about what we've learned? It's, as I was saying earlier, it's really not enough to say, yeah, we know all this is happening. Here's the research report. It's really about, okay, what can we do to make things better? And so on an organizational level, and I will let Dr. Gereluk speak to this because this is something that's been a part of the Werklund School of Education, is the idea of collective well-being. And so Dr. Gereluk, would you like to kind of describe what this looks like within an education faculty?
Yeah, no, really appreciate this. A lot of the discussion in terms of the emotional labor, I think, is very much reflected in post-secondary institutions. And I think in many organizations, and I suspect it probably resonates with many of the participants here today. One of the things, there's always a nervousness when we think about well-being on an individual level. When we think about only on an individual level, we're adding yet another burden to the individual, saying, and we need you make sure that you take care of yourself, and placing the onus on the individual. And yet you really need to think about kind of the ecosystem, and in terms of what is the organizational capacity in thinking about the policies, the procedures, and the practices, and the circles of influence. So in the multiple faceted ways in terms of how the individual impacts the well-being of others, but the others have an impact on the well-being of the individual. And so there is kind of a cyclical element in terms of the way in which we create the conditions for people to thrive and flourish in their respective work environments. And so that is a much more interesting conception. The example that I like to give is one that I think at the Werklund School of Education, we've really made significant strides over the last 5 years. And with some contestation, which is always a little bit irony, because I think everybody wants the elements of self-care, wants to have a notion of wellness, but to put it into specific policies and procedures as a strategic priority adds a little bit of interesting dynamic. So when the commitment over the last 5 years from the Werklund School of Education was to create a strategic priority around collective well-being. And the first resistance was, well, what does well-being look like? Does it matter if an individual is going to yoga or playing with puppies or going for a walk? Is this just a mechanism to tick off a box to say that now we have a better, higher level of morale and culture and ethos within the work culture? And I'd say it's partly that, but it's more than that. What, a number of things that the faculty did was to look at the programming, and it was another dear scholar that works closely with OSTRI, Dr. Shelley Russell Mayhew, and saying, if we're wanting to create well-being in our schools, we actually need to think about that in a programmatic way. And so in the undergraduate program, there was a strong commitment to saying we need a mandatory course on comprehensive school health. And as a dean, there are multiple requests constantly that come into the undergraduate program in terms of we need more English language learning, we need more trauma-informed pedagogy. There are numerous requests, and there is always a limited amount of time. But the argument that was given was compelling. And the argument was, if we don't have wellness of teachers and we don't think about it as a collective responsibility across our schools, wellness is a precondition for learning. And we can't relegate it only to the elementary generalist teachers. We can't relegate it only to the phys ed and health teachers. But this is a collective responsibility, both in how we even think about it, in our formal curriculum, and in the ways in which our schools need to thrive informally, in the multiple informal moments in the time. And so that was a critical component for the ways in which we were preparing our future teachers to think about wellness as a precondition for learning, both for themselves and for others. In terms of the strategic priorities, we started to think, well, what are the opportunities and the structures that we need to do in place to think about collective well-being? And in this case, there were opportunities, there are a number of multifaceted things. We started just actually talking about wellness profiles, modeling the ways to give each other permission to take wellness. And I always say it's a reciprocal element of, if you give time for yourself, you're actually much more productive in work. So work hard during the day and then shut off in work. And so we started to provide examples of the ways in which people filled their buckets or provided wellness opportunities. The other things we started to do is we actually put as a performance element of what is your wellness, what are you going to work on in your wellness as a key kind of conversation that we would have with our support staff and our managers. And in the beginning, people were saying, I'll do something. And I'm like, that's not good enough. We need to start thinking about it collectively in terms of what do I need to do as a leader to provide support so that you're well. And what's interesting is the progression of the wellness over 5 years. There's been sustained improvements. And so you see the culture of an organization change in the ways in which, the practices that happen in terms of the respect to not provide email correspondence in the evenings or weekends, the permission to go for a walk during the lunch hours, the permission to take a break over statutory holidays and not feel the need. And so those were kind of illustrative examples that I think in terms of the ways in which we start thinking about collective well-being, how one's actions is not only about oneself, but the ripple effect that it has on other people.
Thank you, Diane. And Dr. Kapianis, would you like to also answer the question, what does workplace well-being look like to you?
Sure. I really like the way Dr. Gereluk talked about the reciprocity, that we are all intertwined and interconnected. And when I think of our workplace, really think of a culture of safety, of caring, empathy, and compassion. And in order to do that, I think that requires a lot of self-awareness as well. It requires for us to also be compassionate, not only to others, but to ourselves. And within that, I think that is where workplace well-being really flourishes. And I know in the Werklund School of Education, we've been trying to model that and lead with that in mind when we're working with our students and our faculty.
Thanks, Dora. And Carlin, is there anything that you'd like to add in terms of from your perspective?
I think I would just echo what was said before me. I think it's really important to for leadership to model behaviors of self-care. I think it's really challenging for individuals who are reporting up through leadership and seeing their leaders checking emails at 11 p.m. at night and firing off directions at that time, to then feel okay about stepping away and preserving some of their own home time and time to rest and recharge. So I think modeling it is really important within leadership of an organization in order to ensure collective well-being. So I want to just echo the comments made before me.
Thanks. And Lisa, do you have any comments before we move on?
Well, I think that this has been extremely well described by the previous speakers. It was, in fact, I've been taking notes because I always, when I'm presenting or, observing presentations, I always get to learn new things, and I love that. The only thing that I would add here is that we have to recognize, in terms of collective well-being and safe workplaces for everybody, is that we have been in a situation which has separated us. So COVID required us to not have contact with each other. It broke down relationships, and it really, I think, caused our structures of support that we had relied on pre-pandemic to be brought into challenge. And so one of the observations I would make in terms of moving forward towards post-pandemic and into recovery is that we do need to consider making our workplaces places that are psychologically safe and places where people have a sense of belonging. Because when you belong and it's a community, and that reciprocity becomes a whole lot easier. And I think that's part of what Dr. Gereluk was talking about with the work that Werklund is doing. I really love that phrase of well-being is a precondition for learning. And so a part of that means that people feel safe to be able to try new things and to be able to learn, as well as they have a sense of belonging. They know that if they make an error or perhaps they say something that is not exactly right in the moment, that there will be a flexibility around that situation that allows you to come back into the fold, so to speak. So that is the only thing that I would add. I think that the other speakers have done an excellent job of talking about what is needed for workplace well-being. And the only thing I could add is a sense of belonging and psychological safety.
Thanks, Lisa. And so the next kind of thing to think about is, and this is sort of a newer area, something known as collective compassion. And so when you think of the definition of compassion, compassion is the noticing, the feeling, and the acting on the suffering of others. So while we can talk about being sympathetic, that's noticing that someone is suffering but not doing anything about it. We can be empathetic, which is listening and trying and seeking to understand the suffering of another. Compassion has that added step of doing something. So we notice that somebody's suffering within our organization. So in our case, they're feeling compassion fatigue or they're feeling burnout. We feel it with them. We understand how they feel. We can kind of feel, right, that the pain, and then we act, we do something about it. And I would say, one of the best examples of collective compassion in action right now was last week. I was listening to CBC at noon, and they were talking about what people across Alberta were doing in terms of supporting what was going on with Ukraine. And so there was many callers who are calling in to say, at our school we had a bake sale and we were able to raise $200 and we're sending that to the Red Cross. Or people calling in to say, we're having a special music night and the performers are donating their time and all the entry fees are going to this particular organization in Ukraine. And so that was really this sense of collective compassion. So people not only saw it on the news and thought, oh, that's bad, they actually felt like, oh, like I can see myself in there. I can, I cry with them. I feel it too. And then there's that compulsion to do something about it. And so having that collective compassion within an organization is having everyone, so that culture of compassion, recognizing that, hey, people are struggling right now. I see that and I feel that with them. I can, I really feel that. And so I'm in a position where I'm going to do something about that. I'm going to put something in place that can help relieve some of that suffering, knowing that I can't fix it. I can't change it. I can't push people out of the bad things that they're doing, but I can do this thing. This is the thing that I can do. And that helps to restore and create that compassion satisfaction. So it's really important to understand that we can do this in terms of workplace culture. We can do that noticing, and we can do that acting to help relieve the suffering of the people around us. And so the last little thing, and then we're going to kind of talk about these a little bit more in terms of our context that came out of the study, was the idea of heart care planning. And so what heart care is, if you look at what each of the what it stands for, I sat with a piece of paper and a pen, and I used, the first letter, and the best I could come up with was spies. And I didn't think that, we were going to do spy planning, or pies. We could do pies. And so the reason that heart comes out of these 5 words is almost like a wordle. It's kind of random. But anyway, in order to really create that sense, or that culture of compassion, or that culture of workplace wellness and well-being, there has to be several things in place. So the school relates to the workplace and the relationship between people within the workplace, the system in terms of what's surrounding that workplace. So what are the policies? Who is responsible for what? How are things enacted? What is legislation? Then of course there's the individual. So I was a phys ed teacher. So if the individual doesn't want to do something, forget it. Nothing's happening. The professional in terms of access to medical and other help, and then the fact that educational workers have a unique perspective and need to be. So Lisa, I'll just have you explain a little bit about kind of how work, and we've already talked about this, but if you have anything else you want to add in terms of the school or workplace culture, and how that is a key part of building well.
Thank you, Astri. Our schools and workplaces are the place that you spend your days. And so in considering how we build collective compassion and collective well-being within our schools or workplaces, we need to take stock of where we're at and identify what the culture of our workplace or school is, so that we can move forward. So of course, there is a goal setting that can be supported through policy structures, but also should contemplate the physical space of the place that you're working in. We know for sure during COVID that we were really grappling with things like ventilation and spacing in schools. And so that phenomena was something that highlights the need for really healthy spaces in terms of the physical structure of the building. We also need to make sure that the adults, and in terms of education, that both the adults and the children in the school have access to mentorship and support. And then finally, I would say that some of this work around school and workplace well-being isn't rocket science. Some of this is just being nice to each other. And so when I think back to the things that you identified at the beginning of this presentation about what made your week, it was the authentic relationships that you had with your colleagues and with your clients in seeing others succeed. Those are the things that give you joy. And so when we think about the heart care plan and the school or the workplace, we see opportunities to be able to create spaces where we have a collective focus on well-being. And as Diane mentioned, that could take some time. At Werklund, they've been working at this for 5 years, and I'm sure that that's a project that continues to be refined and move forward. So I think Astri, it's largely been talked about in the other slides for the most part, but that's about it. So now it's over to you. How can you as people who work in different areas, how can you support a positive or healthier work culture?
And while we're waiting for people to give some of their ideas, I'm sure you've all been thinking about it. You know, we've given you the opportunity to hear what we've been doing. I don't know if anyone of the other panelists wants to hop in or has any other comments.
Well, I want to build on Lisa's point, even in terms of the physical structure. There's lots of easy, low-hanging fruit, I think, that organizations can do, even to think more holistically about what are the physical spaces that create the conditions for well-being. In a small one that I think actually is quite easy to do is creating, translating an office into a tranquility space. It was one of the initiatives that we did a number of years ago. We again met with some cynicism amongst some colleagues, as there always are. But the rationale was for our academics, we all had individual offices. So if there was a moment where you needed to close the door, take some time, turn off the lights, if you had a migraine, needed to get away from the noise or from individuals, you had it. But for many of our administrative staff and our support staff who are in open carols, are always constantly hearing either other individuals, phone calls, Zoom sessions, it was really highly problematic. And I had tremendous sympathy for them. I would see them in the hallways trying to find a quiet corner to sit, and I'm thinking, this seems to be inappropriate. There is a hierarchy between academic staff that had the ability to find a quiet space if needed, and yet that wasn't the case for administrative staff. And so repurposing an office to actually just have a no tech zone with a chaise or a yoga mat so that people could decompress or take a quiet moment was a small initiative that actually made a huge impact. And so when we think about the policies and practices in our work culture in terms of what are the conditions to have permission? Our leaders, sending out that email to remind people to take the break. Are there mechanisms for agency amongst the work culture? Are there moments for celebration or acknowledgement of workers that might be under the radar who are doing tremendous work? There are different elements that I think that we have to continue to think about the ways in which we create, a healthier work culture. So I just wanted to add that as an illustrative example.
Wonderful, thank you. And I'm just scrolling through some of the things that people are saying here. These are, of course, all wonderful. There's one that kind of comes up a couple times in terms of smiling. And it's interesting, 100 years ago, that's not true, it was about 10 years ago, I worked for Princess Cruises. And one of our kind of rules was you may not pass a passenger without saying good morning, good evening, or good night. And so in terms of any time we were on deck, if we were walking around, if you came in contact with a passenger, you had to say good morning, good evening, or good afternoon. And I'm actually quite a shy person. So for me, it took quite a bit for me to get into that habit. But the funny thing is that I found myself on shore feeling compelled to say good morning, good evening, good afternoon. And even now when I'm out walking, if I pass someone face to face, that smile and good morning, I'd say 100% of people smile back and say, oh, good morning, like just shocked that another human being connected with them. So again, sometimes the things that we can do are small and simple, but absolutely support a healthier work culture. So the next thing is the idea of the system, and Dr. Gereluk, this one will go to you in terms of how you can take a systemic approach to incorporating well-being. You've kind of touched on it already, I'd say.
Yeah, I think, this has been the focus here, given the study and the work that the places where we come has been positioned within education. But I think, when we look at organizational, there are significant parallels to thinking systemically about workplace well-being in terms of the parameters. How do we open up for discussions across our organizations, across our employees and our stakeholders? how do we think about it both internally for our own members, but externally into the broader community and the clients or the broader landscape in which you're in touch with or interconnected with. So when we think about it systemically, again, we're not placing the burden on us, we're going to offer a yoga class and we've ticked off the box, but we have to think in a much more complex element in terms of the what I call it much more of an ecosystem or a holistic approach that looks at the policies, that looks at the procedures, that looks at the practices, both in the formal ways that we prioritize well-being in the workplace and in the formal day-to-day actions that help carry us through, that give us energy in different ways. And so I think as you reflect on this presentation, thinking systemically, where are the points and where are the points of tension? Is it the lack of systems in place, the efficiencies? Is it the ad hoc processes that are creating tensions within the workplace? There are multiple ways in which we need to think about it beyond then we're just going to offer cookies or donuts on a Friday. So I think in terms of looking at systemically, in terms of what are the policies and the practices, what are the key supports, what is the interface between the members across the organization in their respective roles and portfolios, and how do we think externally in terms of the interconnections and the ways in which that we work across different organizations in the ways, whether that's advocacy, action, awareness, understanding. And I think when we think about that, then there are parallels in terms of what we see in education, what we see in healthcare, what we see in the law profession that has a very high level of workplace fatigue in different components. What are the ways in which that we can think in a much more holistic way that that walks the talk, that is not just simply saying we need to think, take care of yourself, make sure you take some time for yourself, but creating those structures in place that commit to the priority of well-being in the workforce.
And so while everyone is thinking, this is a kind of a big question, it's a hard question. So what is one way to improve the system? So thinking about there's the idea of emotional contagion, which is, how one person feels or what they're putting out there kind of is felt by others. So, if you're feeling a lot of anger, the people around you, your circle of influence, might also be starting to feel that heightened sense. Or, if you're feeling hopeful and compassionate, that also may spread out a little bit. So just thinking about there we go. Empathy is a great one. Ways to improve the system. I don't know if any of the other panelists have any thoughts kind of on a system level that they want to add while the screen is populating.
Austria, you and I have talked about this conundrum with respect to education. And so a part of the system that we identify in terms of entry points are with school jurisdictions, because there's a little more agency that can be brought to the table in terms of improving any one school board. But when we get larger than that, and we start thinking about policy decisions that have impact on the work we do, we begin to look at the political, the body politic, and the social context of communities. And in that regard, Austria, you made a very wise observation, I think, in that one of the solutions for bringing wellness into a system is to be able to work in a social justice framework to make things better, not just for your own context, but for the context of others. And so there's been a couple of examples mentioned along the way, things like helping families in Ukraine. That's a way to act systematically that is done at a more local level. But when we think about, certainly in Alberta, we have a situation in education that is very challenged in terms of the body politic that we're living in. The solutions to that are less easy to get to. And writing your MLA does not necessarily bring you joy. So I just want to throw that in for consideration.
Austria, I don't know if I can jump in, and I'm really appreciating the comments here. And I've seen a couple in terms of a stakeholder participation policy revision. And that's where I think you start getting into the deep elements of system reform in terms of well-being. There's some in term, some of the comments that I'm seeing, and it's interesting because it's reflective of the conversations I think in the early days. Well, and I would even say cyclical within our own institution, in terms of where there's individuals that are saying, well, I'd like to have from a 35 work hour week to 20. And I said, there's some variables we can't, that are not up for grabs. It's not simply just reducing work. And so creating the parameters of what's controllable variables versus here's the parameters of the work, a full-time position, in, as an AUP staff member is 35 work hours. So I'm not able to change that. But going underneath that in terms of what are the policies in order to make sure that it is only a 35-hour work week that you're being asked to require? What are the ways in which that if there are elements that are creating changes within the work environment to either be more productive or be more fulfilled in that element, that is something that we can control. I can't change, does it change the nature of the ability, COVID, it's one of the interesting conversations that many organizations are having in the private and the public sector is, do we always need to be there for 5 days a week? Is there a productivity in terms of, we want to have some ability to have relationship and, relational context, and there's a connection. And so I'm a strong advocate for the relational component of being together. But I also recognize, do I need that all 5 days? Do we need that in a work environment? Is there an element in terms of quiet, having focused time to do the heavy, deep work that sometimes requires a quiet spot? And does that need them to be in a large open center? And so when we start going deep in terms of policy revision, stakeholder participation, we can start saying, well, this is what's possible within it. This is what we can actually maybe challenge in terms of the system. And here's, how we might need to think about it in more creative ways. Generally, what it comes down to is recognition, agency, fulfillment, and then just manageability or expectations in terms of not feeling guilty of not working 24 hours a day. And so that seems to lie underneath the surface of these elements of how do we create the agency, how do we create fulfillment in the role, how do we kind of create boundaries between our work and our other elements of our life. And if there are just easy tension points that can be resolved through changes and through some change management processes, then I think we get into the deeper issues as opposed to, and I still agree. One of the funniest things, it was, I say this as an illustrative example. It was one of those moments. It was November and it was raining and it was gray. You could started hearing the water cooler chat. I'm like, ooh, something, things are not feeling right in our faculty. And I said, what we really need is a grilled cheese and tomato soup, Dave. And it was one of the bizarre, but sometimes you do need the informal things. And it was actually the one thing that the faculty always returns to is that moment where everyone was kind of having this moment of languishing. And we kind of laughed about it. It's like, this is what the comfort food was for the organization, was this grilled cheese and tomato. Like everyone just we just kind of rolled up all the crock pots and got at it. But so, it's not, you want to have the policies, you want to kind of do this balance between those informal one-off events that kind of create a little bit of levity in there, but you have to go deep in terms of the policies in order if we're really going to keep it sustained throughout the workplace.
Thanks, Diane. And I think that actually leads well into the next part, which is that individual aspect in terms of, individual self-care and the rest. So Dr. Kapianis, if you want to hop in.
Yeah, sure. Thank you so much. I think it's a really important conversation when we're talking about, we all want to be part of something bigger. We all want to work together around the collective well-being piece, the collective compassion. And I don't think people would argue around that piece. I think sometimes we kind of skip a little bit of a step around where are people at? How are they actually feeling? what might they be struggling with at home and bringing into the workplace. And those are not easy conversations. Those are uncomfortable conversations to have. People don't feel comfortable in sharing those in many ways. And so getting back to also what is the individual's role within that collective piece is thinking about, you know, that compassion and kindness for yourself as well. And I saw in your responses, many of you really talk about the importance of also your own self-care and within that broader context. And so what are you doing for yourself on a consistent basis to bring joy to your life? To be able to sustain the time needed in your workplace. And I think that speaks highly to that we need to start thinking about that in the context of, you know, moving toward the collective piece, but also what are we doing as individuals to support that? And I think though that is a vulnerability because sometimes we feel guilty in taking that time for ourselves. We could be contributing, we should be working harder, we should be responding to those emails on the weekends. We don't have permission actually not to answer emails. That might be something that in your own place, I need to get to those things. And I think that's really important that we start to think about what are our individual needs, because and how do we tend to those needs in order to tend to the needs of others. And so you had lots of examples, and within our own faculty, we've been really trying to model that as well with our pre-service teachers, because of course, we've all gone through many things during the pandemic, and our students as well, and our instructors. And so thinking about their own well-being, because we want them to move into the profession and not burn out within the first 5 years. So how is it that we're proactively supporting them within the work that we are doing, within our coursework, within the expectations that we have, so that they are really thinking about their self-care as well, and how they are going to really thrive as first-year teachers. And so that has been part of what we've been doing in terms of actually incorporating self-care planning into our program, into our coursework, and also talking to students about, and I know Austria is going to talk more about the streaking piece, but we've talked about what is it that you can do for yourself on a consistent basis that's good for you. And that is different for every single person. What is a wellness activity that you can do that brings you joy, that you can take and support yourself with? And so we've been really implementing that, and we have what we called a field self-care streak, and Austria will talk a little bit more in a bit about that. But with the slide up, what are some wellness activities that you can do on an everyday basis that brings you that joy and that well-being piece? And as you're talking, I've committed, I know Austria and I as leaders within field have been trying to model our own wellness activities and to take time for that. 15 to 20 minutes a day to do something that is consistent and that makes you feel good. And I've been committed to physical activity 15 to 20 minutes a day. And so I've been getting out and running and walking, and I've been dealing with my own anxieties, actually returning back to the gym. And so that's been a real kind of journey for me during the pandemic as well. So I see from lots of your activities here, these are really important to think about. How are you tending to your own needs so that you can tend to the needs of others as well?
And all of these are great. So as it continues to populate, just first of all, take a look at some of the different things that people like to do and kind of keep that at the back of your mind. And just in terms of the variety, the huge difference in terms of what people prefer to do every day in order to do their own self-care. And the one thing with self-care, and I find this more so doing stuff when we're face-to-face, is something I like to call the self-care eye roll. And so that, when we say to people, so what are you doing for your self-care? And they just do that, oh, there it is, self-care. And so, I'm kind of used to it. Like I said, I taught phys ed. I'm very used to teenage girl eye roll. But it is something to think about, like in terms of, kind of moving past that initial, sounds like my mom, she's telling me to get more sleep, but into like, what do I actually need to do every day to feel better? But sometimes, it's not enough in terms of what you can do for yourself. There is a need for greater support. So Carlin's just going to talk a little bit about that.
Yeah, so I do think that the professional support can often bleed or complement that, bleed into or complement the self-care efforts that individuals have. Obviously, I'm approaching it as a health benefit provider and a healthcare professional myself. And there's definitely an important role that professional support can play. And I think we can break it, I mean, given that most of us are all Canadians here, we can break it into the two pieces. The first of those is accessing the healthcare system proper to receive care or get support when you need it from individuals like your primary care physician. Some of that professional care might involve ensuring that you are in good physical health. Are there any health concerns you need to worry about? Are there any physical constraints that are impending on your own wellness, or any mental issues that are impending on your own well-being that may need to be treated and treated professionally beyond potentially activities like self-care, but complemented by things like therapy or medication, as the case may be. So there's that first piece in accessing care and professional help through our typical healthcare system. But I think what we see employers doing and benefit providers writ large doing is trying to create wraparound professional care supports to complement what's available within our healthcare system. And depending on what the individual's needs are, sometimes offer more flexibility and options for individuals who are looking for some professional support. So a few examples of that. I mean, very right off the top, one could think of a typical one, such as obtaining counseling through a psychological benefit that a benefit provider might offer you. Having an individual who's unbiased and can provide you with tools and tips to try to deal with issues that are coming at you can be of value and offer you different perspective than simply chatting with friends who have a vested interest as well and might not have the objective perspectives and training that such a professional would have to support you. So certainly, that is one thing that springs to mind right off the bat when we talk about compassion fatigue. But there are other professional services that can help bolster individual well-being that are available as well. So those things might be getting a consult with a fitness individual who can help you manage diet and exercise, encourage you to exercise for the sake of well-being and creating different ways to cope with stress. Regular visits to a massage therapist. Some individuals find that sort of care and professional help does wonders for their mental and physical health. So there's those options that are available to individuals to help them. Another thing that benefit providers often offer are things called employee and family assistance programs or employee assistance programs. And those can tend to be kind of the catch-all for short-term either information sharing or counseling activities if individuals have specific needs. So in the case of my organization, we have EFAP, or Employee and Family Assistance Provider, that provides a range of services, everything from counseling all the way to helping people deal with elder care issues or financial issues that may be weighing on them. So I would say that there's a breadth of professional help depending on the stresses an individual is feeling or what individuals feel are impacting their mental health and their wellness at work. I think whenever I look at this professional piece, as well as that self-care piece, what really underlines things for me is that this model is interactive. And what I think historically, when we look at seeking doing self-care or seeking professional help, that often ends up on the individual. And certainly the self-care and professional piece can provide us with tools and tricks and support to manage through difficult situations within the workplace. But those other components of the heart care model are really important, because if we're just relying on the professional help to give us those tools and tricks, I think we're going to be fighting an uphill battle to maintain our wellness in the face of challenging policies or an unhealthy workplace, et cetera, et cetera. So I would encourage individuals, if they do need to seek professional help, that is a real benefit. And also to seek professional help prior to anything happening, maintaining your wellness, your physical and mental well-being before you need intervention as a way of preventing downstream negative effects.
Thanks, Carlin. And so the last part that we'll discuss quickly is just as we all suddenly get naked and start streaking. No, that's not going to happen. So don't worry. This is not that kind of webinar. Just remember that educational workers, just like everyone in every different field, have unique needs. And so within the educational field, primarily we work with children and youth. Even, speaking to superintendents and bus drivers, custodians, educational workers, all of it comes down to we want to create a safe and caring, warm environment for children and youth to flourish. And that's a very key part of what builds that compassion satisfaction. But it also creates that added layer of distress and moral distress, because when you can't help a child or you feel like you've missed something, the guilt is tremendous. And so, it's really important to remember that that component. And the other part is with children and youth, they aren't resilient yet. They haven't been through anything yet. So every time they experience something, that's the first time they've ever experienced it. So they really look to the adults in their life to guide them through these really difficult times. So, I remember when my hamster died when I was probably 6 or 7, and just being absolutely devastated in terms of that was the first thing that's ever died in my life, was my hamster. And of course, now as an adult, when you talk to a child who's lost their hamster, you can kind of help and guide them through that grief. But it moves them towards when they have to have those bigger griefs. So someone in the chat talked about self-care and finding out that they have cancer, right? So when that happens with a kid, that's, again, they don't have the emotional coping strategies to face these big things, which is why it's so important that the adults in the building and surrounding them are as emotionally and mentally whole as possible. And so that moves us into kind of the so what now. And this is something I would call kind of a quick win, an easy win, in terms of using something called streaking to kind of as a first step or a first idea towards what can you do, right? So is this the answer? Is this my magic wand that I will say, do this, ding, you are now well, bing. I wish I could do that, but it's not. But what streaking is really at its base, the idea is kind of building a daily resiliency or a daily buoyancy, which is, and to explain what it is, it's trying to do something good for yourself every day for consecutive days for as long as possible. And so for this to work, a few things have to be in place. So first, that workplace culture of compassion and care. So, Diane spoke earlier about, kind of building that sense of, yes, you can take time in your day to go for a walk or to have a proper lunch or all those things. If your workplace doesn't support that, it'll be very hard to maintain a streak. You can try, but it'll be more difficult. There needs to be role modeling by leadership so that they are also taking the time every day to do something good for themselves. There needs to be agency. So if we went back to that slide where everybody talked about the things that they like to do to feel better, there's tons of different options. There are 40 responses and almost 40 different things. And so for me to say to you, I want you to do a walking streak, you might say, well, I don't like walking. Why would I do that every day? I'd rather garden. I'll garden every day. So that's why we talk about kind of a wellness streak as opposed to like a specific one. Part of it is accessing experts in terms of ensuring that if you are going to do something, that you have and take the time to get to know how to do it well and properly so that you don't hurt yourself. And then recognizing that it's something that you're doing for yourself, but you're supported by the people around you. So where this came from and why we do this, and Dora talked a bit about the field self-care streak, was back in, these timelines are really hard at this time. So back in January of 2021, my sister, who lives in Fernie, British Columbia, she said, Austria, you know, there's this thing, it's called the Fernie Streak. Will you do it with me? It happens every January. The challenge is to do 30 minutes of outdoor activity every day for the month of January. And at that time, probably like everyone else, I'd put on a few COVID pounds, wasn't feeling very good about myself. My mom had died of cancer not long before, which took a very heavy toll. And so I was kind of looking for something. And so I was like, okay, I can do something outdoors for 30 minutes for 31 days in January. I can do that. And so, you know, I registered, and there's a spreadsheet and you logged all your days. And so, you know, kind of dragged my husband along. It was very cold. It was January. And so we got to the end of the month and I was like, hey, I did it. I did 30 days of outdoor activity. That's great. And my husband's like, well, let's keep doing it. And I'm like, what? Yeah, okay. And so we did. We're like, okay, we're going to make it 20 minutes because that's what we can do. And we're going to just go for a walk every day without a break. And so I haven't missed a day of walking since January 2021. So that's a while now because it's become such a habit for me and something I enjoy doing. It's something that I can do. And, you know, I don't necessarily need to have a whole bunch of things in place for that to work. So, oops. Why didn't that work? There we go. So if you want to try and do a streak, there's a couple ways. So there's like the organized way, right? So find a streak, like we have our field self-care streak, there's the Fernie streak, there's the no drinking streaks. There's tons of different ones, but choose one that you enjoy to make sure that it's something that you want to do. Make sure you have the gear and the tools. So I learned pretty quickly that if I was going to take a walk outside every day in Alberta all year, I was going to need lined pants, special podcasts that keep my mind off the fact the wind is blowing, or, you know, when it was really hot, having the right gear and all that kind of stuff, so that, you know, as soon as I was ready to go, I didn't have to worry about finding what I needed to find in order to be successful. Ask a friend or a partner, and in my case, I kind of made the whole faculty do it as well in terms of the field self-care streak, because it's building that social aspect of it in terms of like supporting each other. And so, you know, I will bring my husband along, or often I still walk by myself because I like to have that alone time. But having that social support makes you more likely to keep your streak going. Start with reasonable goals and reasonable limits. So like I said, you know, initially it was 30 minutes of outdoor activity. I was finding that hard to sustain in terms of fitting it into my workday. So I made it 20 minutes. And most days I end up doing 30 or 40, but 20 minutes is my daily goal. And so that I can achieve every single day because I know that about my life. Some kind of acknowledgement or tracking. So I used my wellness spending account so that I could get an Apple Watch. And then I don't know if any of you out there have Apple Watches, but there's these 3 rings and it says, hey, you know, you haven't stood up yet. Actually, it's been telling me that for the last hour. But it helps to remind me that, you know, I need to stand up, or, you know, I need to finish my exercise ring and that kind of stuff. Or, you know, with our field self-care streak, you can actually go onto Twitter and see some of the things that people were doing there, because it's there on Twitter, putting it up so that other people can see, hey, this is what I'm doing. And then lots of likes and encouragement and kind of, again, that social aspect. And so that we use Twitter, but I know some of our students were doing it on Instagram, others just kind of tracking on a regular calendar, but displaying that, you know, I did this today, right? With the Fernie streak, it was the spreadsheet that you had to go in and give a little check mark that you completed it that day, but showing others, again, that, this is important to me. I want this to happen, and this is how it can happen. And then it's really important to have, as we've been talking about, that organizational support and leadership. So part of the reason that the field self-care streak worked at all was, Dora and myself are both the field directors. So, we could make sure that we were being good role models and showing our students and instructors what it looked like to try and do something good for ourselves every day. But we also, Diane, our dean, was a part of it. She did other activities. The university provost was a part of it. And so because the leadership was saying, this is important, we want to be a part of it, and here's what we're doing every day, that just allowed for that kind of organizational permission to say, yes, take 15 to 20 minutes of your day and go and do that thing you need to do to recharge. Because if you don't, we know that you're not going to make it through the rest of the workday. So that's really the important part. And then the length of time of the challenge also matters. So, with the Fernie streak, it was 31 days. And so you didn't have to go any longer. I did, but of course, nobody has to. So having kind of that set start and set end date can be very helpful within the organization. With the field self-care streak, it's set up and aligned with our field experience courses, so that when students go out to their practicum, that's when it starts, and the end date is their last day of practicum. And so kind of having those set dates is really helpful just for some people, because they may not want to have to do it for 365 days, although that is kind of the best way to do it, is just to keep going. So that is what streaking is all about. Basically, what it is a commitment to doing something good for yourself every day for 15 to 20 minutes. And if something happens and you're not able to complete that goal, it's not about saying, oh, I broke my streak, over, done, not doing it anymore. It's about waking up the next day and saying, okay, today I'm going to go for a walk. I'm going to go for a hike. I'm going to do my meditation. I'm going to try my yoga. I'm going to visit my doctor, whatever it is that your thing is. And then making it, if you don't get it done that day, then the next morning, okay, no, I'm doing it today. Today is the day I'm going to make this happen. And so I don't know if any of you have been playing Wordle. I've broken my Wordle streak a couple times, but I'm still playing. And so the point isn't to, break your streak and then give up. It's to give yourself permission to start again and try again. So, just like with the Oilers and the Flames, probably the wrong audience, but I know with the panel, the Oilers aren't going to give up just because the Flames beat them last night. Although I know there's a couple of people from Edmonton on the call. Maybe the Oilers should give up because the Flames beat them last night. I don't know, but I don't think they will. They're going to keep trying, right? So the same is true with streaking. If it's not successful, then wake up the next day and give it a try, or try it again. And so we have now reached kind of the formal question answer part. I'm going to stop my share so that you can see all of us a little bit more widely. But this is kind of your opportunity to ask some questions of the panel.
Austri, there is a question from Nicole, and it's a fascinating one in terms of where she's questioned about the notion of struggle with the term compassion burnout or fatigue, where compassion is the one emotion that cannot be burned out. We may not feel compassion, but once we feel it, it can only but grow. Is it more so a lack of boundaries? And I love the explanation of emotional output not being met with emotional input. So I'm curious, because I'm not convinced that everyone has compassion. So I'm curious in terms of the thoughts from yourself.
Yeah, and that's a great question, because I've thought about that too, in terms of I think it goes back to what is compassion, right? So if we know that compassion is noticing, feeling, acting, that being the key part on the suffering of others, I think where compassion fatigue and burnout really interferes is at that moment of acting. So we're too tired, we're worn out, we've a changed worldview to negative, right? So we go into it feeling positive and compassionate, but we're now physically and emotionally tired, and we can't take that step towards action. So instead of kind of completing, I guess, getting to that point of compassion, satisfaction, it's, the tiredness and the changed worldview interferes with our ability to act. And so that's why I think things like streaking or daily behaviors, or those bake sales I talked about earlier, those little things are really important, because we can do that last step, we can do that action, and not get stuck in helplessness and hopelessness, which is kind of the opposite of compassion. So we can see the suffering, we can feel the suffering, and then we do that little thing so that we can act on and alleviate the suffering of others. So that would be my response to that question.
And I think it's something I agree with you, Austria. I think, it'd be, I wish we could have Nicole kind of jump back, even in the chat room, because I do think in terms of acting with compassion. And it's something I think that there involves an element of work, right? It involves the element of action. And in the pandemic, it's interesting in the messaging of leaders across organizations is please act with compassion, because there's this element of that we're seeing less, a detachment, given the fatigue. And so what does that look like? And how do we create the conditions to become not because they're malicious, they're just because they're fatigued, right? How do we move it forward? I know that there are other questions in the menti.com that people are putting in. And I don't know if Dora, if you have access to that or.
Oh, there, yeah, I found them. This is the one part of Mentimeter that I haven't tried before, which is kind of the live question and answer. So this is kind of an interesting one, and I'm not even sure, maybe Carlin or Lisa would be able to answer this one. How do the acceptable emotions versus unacceptable? So that's going all the way back to the initial slide for educators and healthcare compared to other professions. I can speak to this a little bit in terms of the emotions, those kind of organizational feeling rules. They do tend to be somewhat specific to the organization. And so in terms of the joy, happiness, excitement, like that was identified within the health or within the educational field. I think if you start looking into, there's a ton of literature on emotional labor, and it is very much related to the different organizations in terms of what is the public face of that organization. And so the emotional feeling rules really come down to workplace culture and what do we expect from the person? So like one of the examples there with policing, the part of the emotional feeling rules or with policing is, being calm, but also being, I'm going to say big, but that's not actually an emotion, but being authoritative. And so that the organizational feeling rules for policing would involve being that authority figure. And so not feeling like the authority would probably be kind of the unacceptable emotion. But there is in fact an entire body of research around emotional feeling rules for different professions. I don't know, Lisa or Carlin, if you wanted to add anything there.
Well, the only thing I would add is that the emotional feeling rules create a persona that you adopt as you walk into your workplace, right? And so in education, what that looks like is that you are there to do everything for everyone. You are the one that will provide the calm. You will be the leader in a situation, especially with the pandemic, where we're all struggling a bit. And I think that idealization of oneself within a workplace means that for the implications are that teachers take on a lot, and so do school leaders, and so they work very long hours, often at the cost of their own families, and so that creates this moral distress idea within our field. And so a lot of that gets linked back into the idea of emotional labor and organizational feeling rules. And I think it's a normative structure that within education deserves some attention and perhaps some deconstruction.
I see two other comments in the question and answer and then the chat room. And I think they're actually interesting and different. Jesse talks about the notion of boundaries, and I think that's a really key component. And one that I think individuals, and in particularly in this context of our society, have really struggled with in terms of, it's a perception that I've heard commonly, as a leader, and saying, you say you want well-being, but I still have an annual performance review. You still want to do this. And I think leaders have to keep on reminding to the messaging that boundaries are important in terms of the work and the personal life. And I think repeated messages of that. One of the other attendees had said, is it okay to change your streaking activities? So I love this question because for people who have, who Austria and Dora have seen me on the field self-care, I actually change my activities every day. I like the variety. So self-care looks very different, probably on a daily basis, depending on which day of the week it is, in terms of what fills my bucket. And that changes on a daily basis for me. I wouldn't want the same activity, but it's why I like the notion of the field self-care streak was just giving the permission for the 20 minutes of a day of what it looked like. So whether I was playing an instrument or gardening or painting, or just taking a lunchtime walk, part of it was the variety. And it's why I think it went beyond just the institution, but went into other organizations, went nationally, went internationally, is the flexibility of just giving yourself permission to say this is important in terms of our self-care and to model it.
Thanks, Diane. There's been a couple of questions about getting more information or slides. So I'm just going to put in the chat. There is a website. So the Heart Care Educators website came out of this study. So a long time ago, and I did see the question, I didn't answer it live. Someone was asking, can we get the peer-reviewed article? You can. It's on that website. And as well as kind of an explanation of the different components. There is a question about there's a big question, which I would put to the panel because it is a very big question. Where did it go? So what are realistic and sustainable solutions? That's a very big question because it'll be different from organization to organization, right? We're looking at a very complex, wide-ranging problem. And sometimes I think with big, wicked, complex problems, sometimes we disregard quick wins, but those quick win solutions can really help you to bridge that gap between, when I was talking about compassion, noticing and feeling, that those quick wins can get you that action, right? Give you that one little thing that helps you to build back your compassion satisfaction. So ultimately, until we get rid of poverty and fix climate change and stop having natural disasters, that end war, like those big traumatic events that make us all feel helpless. Obviously, streaking isn't going to fix those, but it might bridge that gap between looking at the big problems and wanting to act and not knowing what to do and deciding to do nothing. I don't know if anyone else has any comments or questions. I see Diane and Bernie are back, so maybe they have some comments or they'd like to add as well.
Yeah, Austria, I was just going to say, I think really we need to think about how we're encouraging each other as well. And when people are taking those steps to do something good for themselves, how do we react to that? How do we encourage them? How do we model it? How do we say, hey, that's great. How was your walk this afternoon, rather than, oh, I can't believe you had time to go out for a walk today because I have a million meetings this afternoon, right? So how do you respond to that? Because that can make a big difference in how somebody proceeds with their streak as well. And I think that's part of the work culture as well, as how do we lift each other up within our work culture? And just giving that encouragement, that recognition that, hey, good for you that you did that for yourself and you feel better. And I know with our field self-care streak, we get lots of comments about, hey, this is helping me be better in my work, with my productivity, with how I interact with people. And so I think that's really important, those small wins, and that's those efforts. I think that it's those simple things that make the big difference.
So from a leadership perspective, the sustained component is that it needs to be explicit. It needs to be repeated. In terms of, if it is a priority, make the priority explicit. Demonstrate it in the policies, the procedures, and the practices. Do it in the formal level to create the conditions for the informal moments. And so Dora's example of the walk is, I think many people felt guilty saying, this half the time. If the leadership is explicit in the strategic priority, one component of your strategic priority is well-being, then that's a mandate that we need to commit to and have accountable goals of, have we measured, have we shifted the culture and ethos? Have we shifted the number of people who are on sick leaves? Have we looked at it? So there are metrics to look at in terms of sustainability. So they're always the quick wins and the elements, and we always want to do it to elevate and to inspire and to rejuvenate. But for a sustained element in terms of work culture, that's an organizational. And I think leadership have to take a significant and major role in the commitment to create that positive work environment.
I would like to echo that. I think that is a key thing, is building in those policies and, again, modeling behaviors, because it's one thing for leadership to say, yeah, by all means, take your lunch break. Don't worry about working through your lunch, etc. And then to turn around and be modeling behaviors that probably aren't self-sustaining by working through lunch, working late. It also creates almost a guilt within the organization that they should be working up to the level of their superiors, even if the superior says, no, you don't need to do what I do. I just love doing this. It's got to flow through the organization. And I agree, there has to be policies and structures in place to help support that, because without that, North Americans work very hard. We feel bad if we take an hour lunch break. So I think we need to have those processes in place. Otherwise, people do backslide into, well, if I work harder, I'll be recognized, or if I work harder, I'm obviously doing a better job if I'm spending 10 hours in the office versus 8. So.
Austri, there's another comment in the chat about the moral distress in healthcare environment, which causes emotional injury, that we're seeing many great nurses leave the profession. And so educators have a great sympathy, because I think the two caring professions really are feeling that emotional burden in terms of the external political and social context, and in the climate in which, for a number of reasons, the complexity of what's happening in the current environment is too much to handle. Where people came in with a love and a passion for the profession, but are just truly overwhelmed by the political and social and economic context in which we're living. And so I think that's a really, I think we have to acknowledge it and recognize some of the challenges. And I don't think there's an easy answer to that one, in terms of, I reflect on Austri's point in terms of the silver bullet. This isn't a silver bullet. Compassion fatigue, in terms of what are the things that we're able to control, where are the opportunities for agencies within the internal, how do we bracket out some of the very difficult and overwhelming external factors that sometimes are very difficult to negotiate. But I think we have to acknowledge that there is a crisis in the healthcare profession, particularly within the nursing and the medical professions, as there is in the education profession. So part of it is an acknowledgement of that. And I don't know if Bernie or Diane, you wanted to add to that, or Charles, I see that.
Yeah,
Well, I was going to say, I feel like you're talking to me when you say leadership has to take note. I've been taking note, and work culture is extremely important and paramount for us. We've grown from a group of 30 to now 60 over the pandemic, which is wonderful for the organization, but it has been complicated to manage the culture and the changes, especially working in a hybrid work environment. So what I'm interested in, and I wonder what your thoughts are on this, is, we have not mandated a return to work. We have kept it quite loose with hybrid working because we have a ton of people that would be commuting hours a day, and we've been paying attention to surveys which say that staff prefer having the flexibility. But I'd be interested to know where the research is going when you've sort of shifted the culture to a homework environment, which has all sorts of other stresses, and you've taken away that work surrounding yourself by colleagues and the stresses that come up there. And what's going to happen in a few years now that you're not competing directly with your colleagues for attention or different work demands. Now you're on your own, working independently. It'd be interesting. Maybe that's good for lack of commute and you bring back some personal time, but on the other hand, you're not as connected to the company. And what kind of stresses emerge from that?
Well, I think it's lucky that you're talking to one of the top 4 research education faculties in Canada, because the question you've asked, I would say, is something that needs to be investigated. It's the hybrid workplace is, I would say, kind of brand new for most people. So in terms of how all of this is going to interact, I think is in fact an incredibly important area of study and research. And so we're, as a collective, doing some research forward based on the findings from this study. But I think that is kind of a key question for research in terms of how does all of this impact people as they're working from home? Absolutely.
Yeah, and Charles, I think that is the question. I think all private and public organizations are grappling with that balance in terms of, is there a silver lining in terms of the hybrid environment, and what are the opportunities and what are we losing? And I don't think there is any consensus on it. I do worry, I would say on a personal level, that I do worry about a fully remote workforce. I think humans are a connected experience. But is there a hybrid element of working 3 days or 4 days, or working, on together? I think there's something about what does it mean to create a community and team building. And as much as Zoom creates access in terms of people in different locations, there is a loss in terms of the informality, in terms of the informal conversations, the body language that we see, the nuances that we catch in the hallways, in the at the coffee, grabbing a coffee, that I think people are underestimating in terms of what it looks like in terms of the informal collegiality that occurs, the informal ways that we connect as humans. So I think this is the big question of post-COVID is how do we find that balance and the evolution of a work environment that allows for the agency and autonomy, and in some ways providing better access for people that might be, that have longer distances, but also recognizing the need for connection, for dialogue, for community building. And so I think it's actually, I suspect it's going to be a hybrid, if I were to put my money, it's going to be a hybrid model moving forward, trying to do a balance of what does that balance look like to try to capture that.
And my only other comment to that is, in trying to prioritize which staff want to go where, the senior staff, obviously, we can trust to working independently. They like that experience. They know what the work experience was like, so that it's not like they were missing out. And the younger staff that haven't been mentored, you worry about them. But funny enough, just like my kids who are in university and they're studying remotely, they prefer the remote environment. I think they've lost that social skill, but they want that flexibility and they're demanding it. The millennial generation, is demanding the flexibility and the work from home option, or they won't work for you. So that's a reality coming into the workforce. And as much as we think, the old way of doing things is the best way, progress teaches us that there's always new developments, and there will be new ways of learning, and this remote way is going to be here to stay, whether it's as a hybrid format or eventually it will all be remote and we'll be in some kind of metaverse communicating. That's left to our imagination. Good discussion.
Yeah, I just wanted
Diane,
to
I think it's to
say-
you now.
Yes, I just wanted to say that we handpick our presenters. We've had the likes of Charles Figley, Francois Matteau, and yes, even Dr. Gabon Mate. And I must admit that my first interest was generated by streaking. I've got to tell you, but at the same time, I want to remind you that streaking does not involve protecting you, public nudity. So that's for sure. But of my first, contact was with Astrid, and I just want to tell you what a pleasure it has been to, work through this process. And so I think we're going to go over here and do some prize. I want first, Bernie, we always have a message for our audience, and here it's on my shirt. Do you want to read it?
Self-love is magical.
And self-love and self-care is magical as well, but so is winning a prize. So we're going to go to the wheel.
I hope everybody can see the wheel.
Can you see? We know some of these people. Look
We
at
know
that.
them all.
Oh my God.
Yeah.
Oh my gosh. Do you see that?
Are we spinning the wheel?
Yep. Hannah Utam. I hope I'm pronouncing her last name correctly. Okay, we've got to remove her now. It's in between. Michelle McClure, she's been communicating with us over the chat, so that's a good one.
Okay, that's two winners.
Come on. Well, you see, it almost landed on Colleen. Ruth Wilcox. She's the executive director of Ontario Brain Injury Association. This is so exciting.
Congratulations, Ruth.
One more. Stacy Campbell. Okay, congratulations to all the prize winners. I hope that everyone who joined us today enjoyed the morning as much as we did. And I hope that there's been an improvement of the condition of your bucket. And we are going to, because of your message, smile more, Bernie and I. And so thank you to all for sharing this experience with us and for taking the time out of your day to learn even just a little bit more about compassion fatigue. We call it CF because we're allowed to use the acronym. I think that we all understand that this is not just about one conference. It's a continuous process. After today, we hope you will keep the conversations going about workplace burnout, self-help strategies, why we respond to the things the way we do, and how important it is to take care of ourselves while caring for others. If we continue to share our stories, we will continue to learn from one another and find ways to support and care for one another. Thank you to Shelley and Brenda for coordinating this live event. You know, it's just amazing. I am technologically compromised, so I just don't know how they've managed to do all these things. And a heartfelt gratitude to Bernie and Charles.
I just want to add something. There's been a lot of comments as to whether or not this has been recorded and whether or not you'll be getting a copy. Not only will you be getting a copy, but feel free to share it with all your colleagues and friends, because I think what we learned here today is invaluable and will go a long way to helping us deal with this pandemic and compassion fatigue.
Well, as you can see, Bernie is the promotional guru at the firm. And so I'd like to again thank Bernie and Charles for always supporting this event and many other events that offer support to our community. I, for one, am so proud to work at this firm. So to you, Charles.
Thanks so much, Diane. Thanks. You can, her passion is contagious. She is she was the visionary behind compassion fatigue for us to get involved in it. I don't know, probably 25 years ago. I think we feel like we've been doing this for almost 20 years at least. And it's such an important part of what we do. It's our signature event. Diane brings us fresh ideas every year. And it really started as a kernel when Diane met with some of the social workers from trauma hospitals, asking them, you know, what's missing from their education component. And they all indicated resoundingly that it was resilience training with compassion fatigue. And so, you know, the passion and the energy that comes from Diane, it permeates through our firm. My dad is obviously very passionate about it as well. And I want to also just again congratulate them on putting on such a great event. Congratulate Brenda and Shelley. And of course, thank you, Lisa, Diane, Astrid, Carlin, and Theodora. What an amazing presentation. I love the interactive component. It kept us connected, even though we are not, you know, in the same room. It still felt very connected. And I want to thank everyone for attending this morning. We're so proud to host this conference. As I said, it's our favorite way of giving back to the community and supporting others. Steve Maraboli, the author, stated, "Life doesn't get easier or more forgiving. We get stronger and more resilient." And now that I'm on the other side of 50, the world is starting to look a little different from my view. Life is moving much quicker. Health and family is becoming more and more paramount. It's important to breathe, take in life, and be mindful about what life is around you. I often chat at these conferences about a close friend of mine who is a double amputee and both of his legs were lost due to an infection from surgery. And whenever things get tough for me or things look down, I just think about his situation and how he's managing. And he's a wonderful person and has a wonderful family and just copes with it so perfectly. It's important to prioritize what's important. And for me, it's spending time with loved ones and my dogs and keeping myself healthy and regular exercise, all those things we talked about. And yes, I do Wordle and chess to keep myself and my mind occupied. We hope today's presentation has given you valuable experience and left you with key takeaways that you can use every day. As a firm, we're committed to supporting you and your work. And today our goal was to understand better what we can do to prevent stress and burnout and in our workplaces especially, and to continue the great work of caring for others. So thanks to everyone for attending, and we hope to see you again next year. Thank you.
Thank you for the opportunity.
Bye, everyone.
Thanks so much.